Classification of the chronic lower extremities venous disease. So firstly, we are looking at the clinical classification. So in the clinical classification, there is something known as C0. C0 refers to there is no particular visible or the palpable signs, and this is nothing but of the venous disease. Next, we are looking at C1. In case of C1, there is the telangiectasis or the reticular veins. Now, moving on to the C2. C2 includes the varicose veins as well as the recurrent varicose veins. Now, moving on to C3. C3, here the 3 looks like an E, so it is the edema. So it is nothing but C3 is associated with the edema. And looking at C4. C4, it refers to the changes in the skin and the subcutaneous tissue. Secondary. So it's secondary to the chronic venous diseases, and this can include for A, B and C. So A stands for the pigmentation as well as the eczema. 2 stands for the lipodermatosclerosis as well as the atrophy blanche. So the C, it refers to the corona phlebectica. Now we are looking at the C5. C5, it refers to nothing but the healed ulcer. Then moving on, the C6 and the C6R. R is nothing but it stands to the recurrence. So what does the C6 stand for? The C6, it stands for the active ulcer. And looking at the 6R, it is nothing but the recurrent active venous ulcer. Now moving on to S. What is this S? S is nothing but with symptoms. Symptoms which is attributable, this is to the venous disease. Then we are looking at A. What is A? A stands for the absence of the symptoms, and this is attributed to the venous disease.